We are joined by the president of Henry Ford West Bloomfield Hospital, Eric Wallis, with us now on the Oakland County Megacast. President Wallis, thank you for being with us today.
Hey, thanks for having me on again today, guys.
How are you? How's your team doing at the hospital?
We're doing well. I think we've been very fortunate, and I would say I would want to thank the citizens of West Bloomfield and the surrounding communities. We've I guess been very fortunate that for the most part we haven't seen a huge uptick of COVID positive cases coming into the hospital. We've seen a few more folks coming through the emergency department that are testing positive, but it's a pretty small number at this point. So so far so good. But I think that the steps that you just talked about from the governor, I think, are absolutely the right thing to do to make sure that folks are wearing a mask and taking care of one another.
Even though COVID cases are on the rise, as you had mentioned, in your case, the hospitalizations for COVID-19 haven't been as high. Hospitalization rates in this recent spike have been relatively low. Same with the death toll. Why does it believe that this is happening? Is it because of the younger population that's generally falling victim to these new cases, or other factors that play as well?
No, I think you're absolutely right. I think that, generally, while younger folks are being affected more in this particular wave, they do tend to not have as severe symptoms, although I would really caution folks in those age groups to assume that because a lot of folks don't, they won't. We've throughout this event had a number of what I would consider very young folks in their 20s and 30s be sick enough to be admitted to the hospital. I think the challenge is that we know still so relatively little about this virus and how it's going to affect folks. And some people are going to have really severe cases of it, and others are going to be okay. And frankly, that's just not a game that you want to play and take your chances with. So, because the consequences are pretty high.
Is Henry Ford Health System worried about another potential widespread outbreak of this? If this does surge, is that a cause for concern for Henry Ford West Bloomfield as well? And are any steps being taken to prepare for the possibility that this spike becomes a surge and the hospitals begin to begin once again to have an influx of COVID-19 cases come in?
Yeah, I think since the beginning of the time when we started to see our cases decline in the community, we've been preparing for wave number two. Unfortunately, what we're seeing is we're still in wave number one. So we've done a number of things to keep ourselves prepared and be ready. And I think things like our health system now has at least a 100-day supply of every kind of PPE that we would need based on our highest consumption rates. So we've kind of stockpiled things. We've learned a lot about this virus as we've gone along and how to keep people safe. Just was looking at some data today. I'm excited to say next week I think we're going to hit 2 months since we've had one of our team members test positive because we've just kind of learned how to keep people safe while they're here in the building and how to treat our patients. So there's a lot of work going on behind the scenes. We fully expect to have bumps along the road as we go through the fall. And really, until we get to a point where we have an effective vaccine, this isn't going away. I think that, some folks thought that the warm weather would make it go away, like we see sometimes with other viruses. That's not held to be true. We don't know yet whether or not, because there's just not enough scientific evidence that, folks who have had the virus, can they be reinfected or not? We're still kind of a little bit in the learning phase on some of these things. But we've learned a lot over the past 3 or 4 months so that we can deal with this if it comes again.
Eric Wallis with us. He is the president of Henry Ford West Bloomfield Hospital, on with us on the Oakland County Megacast. Now, at this current time, we're seeing a spike. It's a cause for concern. It's certainly not a cause for panic right now. But if we do end up in a situation where Michigan's spike mirrors that of Texas, of Florida, of Arizona, of other states in the union that are seeing these major spikes right now, can our hospital systems in the state of Michigan survive a major surge like that once again, or are we going to see similar issues to what we saw during the major portions of the first wave that we're still, as you said, working through?
A lot of it depends on how and where that spike comes. One of the challenges that we saw with the first kind of onset here was that it was primarily concentrated here in Southeast Michigan. And so, we got to a place very quickly where all of our, resources in the region were being utilized And we were trying to look for help from outside the region, really, to spread out and take care of those patients. If we get to a place where we have a specific region that spikes like that again, we very well could be back in a place like you're seeing in Florida or Texas or some of these other places where resources get really scarce, and the ability to have ICU beds and vents and those kind of things become more of a challenge. If the spike becomes more of a statewide surge, which I think is a little bit more of what we're seeing right now, then the resources and the need for resources are a little more spread out, and it's a little easier to manage through that. So we're kind of preparing for both scenarios, and I think if other parts of the state get to a place where they need some help, we're prepared to try to help them out too, because we had some great folks that helped us out when we were in kind of dire straits.
For those of us that don't have experience in the healthcare industry, can you explain a little bit why we were seeing employees be laid off from hospitals, and a little bit about how the financing works and trying to reopen the hospitals back open, or reopen hospitals to elective surgeries or other health issues, and how that helps your bottom line?
Yeah, no, that's a great question, and it's probably about a 2-hour finance class. But in short, it really, the finances of healthcare right now, healthcare systems, hospitals, really make their profit, make their resources on elective cases. Our commercially insured patients who come in and do want knee replacements and hip replacements and some of the more elective cases. That helps us to supplement. It's a little bit of cost shifting to supplement some of the things that don't pay us as well, like medical cases, ICU cases, et cetera. And so what happened during the first surge of COVID was we had so many patients that were taking up resources. Every single bed was filled with a medical COVID patient. The ICUs were full, that we really had to shut down doing all of those elective procedures and surgeries. And so what really happened, and I'll speak really for the Henry Ford healthcare system, is over the course of this year, about $700 million worth of revenue just disappeared. And so it's certainly you can imagine your own checkbook. If all of a sudden you're bringing in $700 million less dollars than you planned for, that has some significant financial ramifications. We've been very thankful, very blessed that the federal government has stepped in with the CARES Act. They've provided to our health system currently about $400 million of relief. At the best right now, at best case scenario, that will help us to maybe break even. And even if we break even, that's still going to be something on the order of $700 or $800 million of less revenue than we were planning on. So it really is significantly concerning to us. Not having that revenue takes away our ability to provide services in the future, takes away our ability to buy new equipment, takes away the ability to give raises. And so part of our recovery plan, unfortunately, was that when our volumes were down and when we had areas that were being underutilized, for instance, our surgical teams, if they're not doing cases, their skill set's pretty specialized. You can't just pick a nurse up who's worked in the OR and say, hey, go work in this ICU. And so we made the very difficult decision to furlough some of those folks who were in places where the work was low. We did a lot of, having folks shift and work in places where we had need. But unfortunately, we did have some folks that we just didn't have the place to move them to. So it led us to try to furlough some of those folks. At the end of the day, most of or all of our executives across the system also took significant pay cuts this year. And what I'm really proud about the Henry Ford system is we didn't take those pay cuts or the money from those pay cuts from our executives and put them back in the coffers of the organization. We turned around and put that into a fund to help all those folks that were laid off or underemployed, so that we could help them stay financially afloat.
Eric Wallis with us on the Oakland County Megacast. He is the president of Henry Ford West Bloomfield Hospital. So in the early months of the pandemic, PPE stocks were really sparse for hospitals, definitely in southeastern Michigan, definitely in the state of Michigan, but really all throughout the union entirely. How is the hospital's PPE stock doing now? Are there plans for increasing that stock of PPE as you prepare for the potential of a second wave? And if there is a second wave, do you have enough to combat that like you may not have had at times during the first wave?
Yeah, no, we're really in a pretty good place right now. We've been very fortunate. We've got a great partnership with Ford and other folks in the community. Ford has loaned us a warehouse in Dearborn that, like I said, right now we've got a 100-day supply of pretty much everything that we would need from a PPE standpoint. I think you've also probably seen in the news where Henry Ford is one of the several health systems that have come together to actually buy some ownership or create some manufacturing here in the community to make our own PPE. So that we're not still back in a place where we're dependent on, PPE that's coming from outside the country to come here to Michigan. We had a real challenge, and just as we were trying to buy PPE during the height of this, so was everyone else in the country, and so we were all competing against ourselves. We were competing against the states. We were competing against the federal government. And it just really was a bad situation. So we were very fortunate to be part of a strong healthcare system that did a great job of looking for sources all over the world. And we were flying things in from the Middle East. We were flying things in from China as we could, looking for new suppliers, working with local manufacturers to make PPE. So it's been a lot of really hard work. But like I said, I think right now I feel very confident that if another wave comes, we've got what we need to be safe and keep our patients safe and keep our team safe.
We've touched on the need for Henry Ford Health System, and including Henry Ford West Bloomfield Hospital, to have to furlough some of their workers from certain units that maybe weren't going to be utilized or were very specialized during the height of the pandemic. Are some of those workers now coming back? Are they still on furlough? Is there a chance that we will see some of those workers come off of unemployment and back into the hospital soon as elective procedures become more common?
Yeah, no, absolutely. And actually, I saw a report this week that over 80% of the people that we furloughed are now back to work. We've tried really hard to get folks back as quickly as we can, as we hopefully can, as the work comes back. We've been very fortunate. We spent a lot of time having almost one-on-one conversations with patients who delayed what was elective care or non-time sensitive care, and so a lot of those cases have come back now. I really am grateful for the faith and trust that the community has put in this hospital to know that we can keep them safe. We can provide the care that they need, and they don't have to worry about, are they going to come into a hospital and get COVID? So as those numbers continue to grow, we've are probably just a little bit ahead of what we planned for when it comes to a return to business, which is a great thing because we're seeing patients who needed care that are getting it again. And so as that continues to grow, we're going to keep bringing those folks back as quickly as we possibly can.
Eric Wallis, president of Henry Ford West Bloomfield Hospital. Before we let you go today, anything else you'd like to touch on?
Yeah, I think, there's been a lot of discussion, I think, about the governor's mandate of implicit bias or unconscious bias training for healthcare workers. And I just would say, from the Henry Ford healthcare system, that's something that we've done for our folks for a number of years. And so it's not a new requirement. It's something that has been part of the core foundation of who we are as a healthcare system, to try and make sure that we care for all of our neighbors equally, that we make sure that we're providing the very best care we can to all communities. And so welcome that decision. I think it was a great one. And I think it's going to benefit kind of everybody as we see that roll out across the state.
How does Henry Ford West Bloomfield Hospital and really Henry Ford Health System on a broader level employ those implicit bias training? What does that look like? What kind of training procedures are your staff undergoing? Who among your staff has to undergo that? And how effective are those training processes?
Yeah, so for us, it's everybody. It's not just our licensed folks. It's everybody who works in the organization that gets trained. It's a variety of things. It's in-person classes. It's online trainings. We look at a lot of the national data. We pride ourselves in the diversity of our workforce. I think recently, several years in a row now, we've been ranked in the top 2 or 3 in the country for diversity amongst our workforce and our commitment to diversity. And so it's something that's, like I said, it's just kind of the core of who we are. We serve a lot of very diverse communities, even here in West Bloomfield. We got a lot of different ethnicities and folks that we take care of. And so our goal is to make sure that we provide the highest quality care to everyone that enters our building.
President Eric Wallis from Henry Ford West Bloomfield Hospital, thank you for being with us today.
Absolutely. Thanks, guys.